All right. Well, thank you everyone for joining. Welcome to the webinar. My name is Rachel Gore-Moses, and I'm the current president of MDCGC and also part of the Public Policy Committee. And so today we have a number of representatives from the MDCGC Public Policy Committee, as well as representatives from the Maryland Board of Physicians who will be presenting, where we are so far with efforts to enact licensure, answer any questions that you have. Layla Jamal, who is the current chair of the Public Policy Committee, will be moderating with questions. And so I imagine there's a lot of questions. We'll try to keep this as organized as possible. And if there are any questions we don't get to, we will be putting together or working with the Maryland Board of Physicians to put together an FAQ document. So we will make sure to answer your questions, even if we don't get to it today. And so to start us off, I would love to introduce Margot and Carolyn, who are two members of the Public Policy Committee who have been incredibly involved in licensure efforts from day one. And we're so grateful to all of the work that they've put in and that they continue to put in as we cross the finish line and in-state licensure. So let's start with that, and then we'll introduce our members from the Maryland Board of Physicians. So thank you again for being here, and hopefully we can answer some of your questions and get things rolling.
Thank you so much. So my name is Margot. I am one of the members of the Public Policy Committee, and I am one of the members of the Maryland Board of Physicians Genetic Counseling Regulatory Committee. Say that 10 times fast. So I'm just going to start off and then we'll introduce everybody who is on the call as well. So again, just as a reminder today, the first 30 minutes are going to be a presentation from Carolyn and I just about licensure, covering some of the questions that are in the law, and then also some of the questions that might have come up from rulemaking that we've gotten some clarification on. And then we will have a FAQ session. And thank you so much to the Maryland Board of Physicians committee members for joining us. So there's two parts to the committee. Myself, Carolyn, and then Katie Basorti, who couldn't join us today. Dr. Barth is one of the physician members. Dr. Hamish is another physician member, as well as Dr. Amy Lawanda. And then Kim is also on the call, and she is our consumer member. So as a reminder, the committee is made up of 3 genetic counselors, 3 physicians who work with genetic counselors, and then a consumer. And then the Genetic Counseling Advisory Committee members, I'm going to let them introduce themselves. So Stacy, or Ellen, if you want to go first, she is the Deputy Director.
Hi, my name is Ellen Douglas-Smith. I am the Deputy Director of the Board of Physicians.
Thank you. And then we have Stacy as well, who's joined us today.
Yes, hello, I'm Stacy Darren. I'm Board Counsel to the committee. Nice to see everyone.
Thank you. And then Matt is also here.
Hello, I'm Matt Dudzik. I am the Manager of Policy and Legislation at the Maryland Board of Physicians.
And then we also have Felicia.
Good morning. My name is Felicia Wright, and I am the manager of the Allied Health Unit here at the Maryland Board of Physicians.
Thank you so much. So as you can see, we have a very wide group of individuals who make up this committee, and we meet on a monthly basis for the rulemaking. And just as a reminder, if you are interested in serving on a future committee, please reach out to one of the genetic counseling committee members, and we will definitely help you with that process. But before we move on, we just wanted to clarify a couple of acronyms that you might see frequently throughout this presentation. The first is MDCGC. Hopefully you know what that is, but it is the Maryland and DC Society of Genetic Counselors. The Public Policy Committee is PPC, which is our internal Maryland subcommittee. And then MBP is the Maryland Board of Physicians. So you'll see those frequently. And just as a disclaimer, this presentation is just to answer some of the FAQs that we have. So it is not legal advice by anybody on this call. And if you have questions about your day-to-day workflow changes and licensure, please make sure that you talk to your internal compliance department. And this isn't for CEUs, but just some disclaimers. I am an employee of Ambry Genetics. And Carolyn? No disclaimers. Okay. Okay. So just as a reminder as to what we are talking about. So on May 30th, 2021, the law that allows genetic counselors to become licensed was enacted, and it became active on October 1st, 2021. But between a law becoming active and it going into place, there's a rulemaking period, which is what we are in right now. And rulemaking is at this point complete, or almost officially with the seal of completion on it, which is the reason why we can have this FAQ. And just as a reminder, we always want to thank the individuals who helped get this law passed, specifically Dr. and Senator Dr. Clarence Lamb and his staff, as well as Delegate Alfred Carr, who was our House sponsor. So just as a reminder as to why we decided to pursue licensure in the state of Maryland. So licensure allows the public to be protected from unqualified providers. So basically everything that had to do with the rulemaking, at the end of the day, the question was, does this protect the public? And so it protects against unethical providers or incompetent providers, and applies sanctions, as well as the possibility of suspending or removing license, and allows providers to identify themselves that are qualified. And the delivery of healthcare services is regulated at the state level. And this also allows for economic savings because, as you know, genetic counselors utilize appropriate genetic testing, and therefore should be recognized. So the first question is, who needs a license? So if you want to call yourself a genetic counselor, or you want to practice the act of genetic counseling, and if you'd like the definition of that, it's in the law, then you need to have a license. And in terms of telemedicine, this is a question that we get. It really depends on the patient's location, not your own location. So if you are providing services to a patient who is in the state of Maryland, you need to be licensed in the state of Maryland, or any other state if you're providing services to a patient in another state. So who does not need a license? So students who are enrolled in a genetic counseling training program, as well as individuals in another state. If you're consulting, I believe it's less than 10 patients per year in the state of Maryland, do not need a license. So when do you need a license by? So you will need a license, or you will need to have applied for your license by January 1st, 2024. And we will be going over that timeline of the dates that you can expect in the upcoming months. But that is the time that you need to have applied. It is a 2-year license. It will expire on the same date, every 2 years, and you will be notified in advance when the renewal window opens. But first, we're really going to be focusing today on establishing your first license. Obviously, no one's renewing it yet. So what do you need to do to get a license? The first is with ABGC certification. You will need to have that certification, and you will need to verify your degree. If you do not have certification, you will need to have completed a master's program in genetic counseling. You will have needed to practice in the state of Maryland for 10 years. We need 3 letters of recommendation from individuals who are licensed, like a physician or another genetic counselor, and it is time limited. So if you do not have an ABGC certification and you plan to get Maryland licensure, you need to do so before December 31st, 2024. After that, that grandfather clause window closes. Okay. So just kind of running through this timeline, and I know we're going quickly, but it's because I want to make sure we cover everything and we have time for questions. So this is going to be recorded and this will be available just as a reminder. So October 23rd is the official license application open date. That is the date that you can actually apply for your license. But between the time of October and December, you need to get your background check. We're going to talk a little bit about the logistics of getting that background check. Make sure you are in good standing with ABGC. So if you are not ABGC certified, please recertify and make sure that you are up to date with your CEUs as well. And make sure if you need to, you request and collect those letters of recommendation. In November, there will be an online application and you will need to pay your fee. And we will talk about the fee in a moment. And so there is a place for you to complete everything online, as well as the documents that you need to fill out are online. We'll be providing those links. In the meantime, the Maryland Board of Physicians staff is going to confirm the certification and issue your license electronically. And then January 1st, the licensure will go into effect. All right, so I'm going to pass it off to Carolyn to talk a little bit about the logistics specifics.
Great, thanks, Margot, and thank you all for joining today. Despite this slide, I'm actually kind of excited that we're here. It's been many years of work, and I'm excited to see that it's actually all coming to fruition. So Margot, next slide. And I will go through some of this fairly quickly because we will make both the recording and the slides available to you, as well as there are going to be FAQs on the MDCGC page as well as on the Board of Physicians page. So you will have lots of resources for this information. But one of the main things that we said is that to initiate or get your first license, you have to complete a criminal history records check. And this is required for all health occupations that are under the State Board of Physicians. Next slide, Margot. Sorry, Margot has the slides. And this will be a background check both at the state and the national level, so federal level. And it's conducted by this long name, the Maryland Department of Public Safety and Correctional Services, the Criminal Justice Information System. So once that background check is performed, it will be maintained in the Maryland and FBI databases. And so what we need to do is we have to apply through the CGIS for this criminal background check, criminal history records check. And that basically is two things. One is having fingerprinting done and then paying your fees. Next slide. And this timing, one thing that's really important that we want people to understand is the timing is important. So we somewhat held off on having this webinar until we were certain when the applications would be available, because you cannot request this criminal history records check more than 90 days before you submit that application. So now we're within that window, but the board is only authorized to retain the criminal history records check for 90 days. And so it needs to be that sweet spot. And ideally you should do it about 6 weeks before or within submitting your online application. So we're heading into that time period right now. Next slide. And so part of the criminal history records check is that fingerprinting. And so if you can go in person, this is the quicker option in terms of the turnaround time. Generally, it gets to the board. The fact that you have completed the criminal history records check gets to the board within about a week. If you cannot physically go to a location in Maryland, then you have to request a fingerprint card that will be mailed to you, and then you mail it back. But in that case, you need to leave at least 2 weeks for this process to be completed before your license can be issued. And please don't contact the board to verify the receipt or submission of any of the criminal history records check. They receive automatic electronic notification directly, as well as or simultaneously to when you are receiving that information in the mail. So just wait for it to come to you in the mail, and if you have it in the mail, the board has it. Next slide. So as I said, it's in-person fingerprinting. The main places are at the MVAs throughout Maryland. They're listed here. And if you needed to do it for some reason for priority appointments or faster, there is a location off of Reisterstown Road in Baltimore. There's also numerous private locations that you can go to, and we have the link here. They're listed on the Board of Physicians website, so you can find all of the private places that generally may be more convenient for people throughout the state. Next slide. So this is what you need to get that fingerprinting and get everything completed. So you'll need the agency's name, you'll need an authorization number and the ZORI number. All of that will be in the application and in the online documents and FAQs. You'll need your government issued photo identification, so your driver's license or passport. You'll need to have printout and completed this application. And then you'll need a way to pay, so either a credit card or a debit card. So those are what you will need to sort of make sure that you get through the process quickly. Next slide. And we know this has been the $1 million question for many years now, is what is this going to cost? And so first, I just want to set this up by saying that the fees are determined during rulemaking. And in Maryland, and actually in all states, the fees have to be cost neutral, meaning that the cost of licensing all of the individuals in the state has to cover the cost that it requires for the state to issue and maintain those licenses. And so in Maryland, they look at what are the number of genetic counselors in Maryland, and then we look at what percent of the total allied health group that's covered under the board are genetic counselors, and it's calculated from there. So for your initial fee for licensing for the first time, it will be $300. If you're a new student and you're just getting, or you're a new graduate, I should say, and you're getting a supervised GC license, which we'll explain more in upcoming slides, that's $100. When you go to renew at 2 years, that is a $250 fee. And then there's a $26 fee that is set by the Maryland Healthcare Commission, which our friends from the Maryland Board of Physicians have said that sometimes it can be waived, but that one is completely out of our control. And we do have a plan in place to reassess the fees and costs after 2 cycles of genetic counseling licensure, which will be in about 4 years. Next slide. This is a summary slide of sort of what the total cost will be to you based on the fact that there's the licensing fee, but then also the state and federal background check, as well as the licensing fee. So you can see it's around $350 for kind of all in. Next slide. We had received a bunch of questions about what if you're licensed in another state, and you will need to provide documentation of licensure as well as your ABGC certification for all other states in which you have a license. And essentially what this boils down to, my understanding, and others can correct me, is that you will need to, there are forms online. So for each state that you're licensed in, as well as ABGC, as well as to verify your education, you will just fill in a form that with that information, send that to the appropriate entity, whether that's your genetic counseling program or the specific state licensure board. And then they will get that form back to the Maryland State Board of Physicians verifying that you are in good standing. Next slide. This is the same information I basically just said, but the verification of your credentials will come directly from the source in question. So we will request a certification registration number and the date of certification from ABGC. Same thing with your graduate program and then other licenses, other state licenses. It's 2 years away for all of us, but what will you need to renew? So an online application, just like for the initial application, pay the renewal fee, and then you just need to maintain your ABGC certification. So for many of us, it's just getting your CEUs and recertifying I think we're all in the 5-year plan at this point, the 5-year recertification, and it'll be just having ABGC verify that you are still certified and in good standing. There are a few other kind of standard requirements that are in the law, but this is essentially what you need to do in order to maintain that, to renew. So another thing that I know is a big question is what about new grads? And so the agreement was we couldn't have a truly temporary license. So what we have is a supervised genetic counseling license. And so this will be issued to people who have graduated from an accredited genetic counseling graduate program, people who are board eligible, and then a requirement too is that you have to apply for the first available certifying exam upon graduation. So once you have your graduation, then you have to apply to that first exam. This supervised genetic counseling license cannot be issued to anyone if you've failed the ABGC exam 2 or more times, more than 2 times. And you'll see this on another slide, a supervised GC who has not passed the exam within 2 cycles may not continue practicing under supervised GC license. So moving on. And so the way the law is written is supervised genetic counselor may practice only under the supervision of a qualified supervisor. We'll define qualified supervisor in 1 second. But the qualified supervisor and the supervised GC must enter into a written supervision contract. We will get examples of what that contract can look like out to the membership, likely posted in the FAQs on the MDCGC page. But essentially, you just need to maintain documentation of that agreement as well as any meetings that you have. And that supervision contract has to specify the manner of supervision, any alternative qualified supervisors as appropriate. So say the qualified supervisor is going on vacation, who else can that person go to? It has to be signed by both the supervised GC and the qualified supervisor. And then both the supervised GC and the qualified supervisor need to make sure that you keep that documentation of that agreement and any meetings that you had regarding supervision. Just keep that in a folder, essentially, because if there were a complaint, you need to be able to give that to the Board of Physicians if they were to request that. Next slide. In terms of the type of supervision, so the supervision is defined as ongoing direct clinical review, and essentially you have the qualified qualified supervisor. This is where this alphabet soup. The qualified supervisor has to be readily available during these interactions with the patient. So it doesn't necessarily mean that the qualified supervisor has to be in the room. Doesn't mean they have to be in the building. It just means that if that supervised genetic counselor had a question about patient care in any way, they can contact that qualified supervisor for guidance immediately. And then I think that's everything that's on that side. So again, you would make sure that that is outlined in the contract that you put together. And then this question about who can be a qualified supervisor. So anyone who is a licensed genetic counselor with 3 years of experience can be a qualified supervisor, and a physician who's been licensed in the state of Maryland for greater than 5 years or greater can be a qualified supervisor. Next slide. The supervised genetic counselor license, it cannot last more than 1 year, and it expires either because a full GC license is issued, so you passed boards and you provide that ABGC certification, so you have a full license. Notice of not passing the certification exam on your 2nd attempt, or it will just automatically expire if for some other reason, or if these aren't met 1 year after it's issued. And if the supervised GC doesn't pass the certification exam on their 2nd attempt, they're expected to report that to the Maryland Board of Physicians. At that point, you are relinquishing your supervised genetic counselor license, and you cannot continue practicing as a supervised genetic counselor or under that license. Another thing that we were able to explicitly state in the Maryland law is that genetic counselors can order genetic tests. It's defined in the law specifically as identifying, ordering, and coordinating genetic laboratory tests or other diagnostic tests as appropriate for the purposes of genetic assessment. Genetic assessment is also defined in the regulations, but it's important that it also specifies that the counselor shall refer the patient to a licensed physician or other appropriate health care practitioner for diagnosis and treatment. And so I think most of us probably do that already, but it's just going to be important that in your patient letters or in your clinic notes that you specifically say the patient has XYZ and they should see their primary care provider, their medical oncologist, the pediatric geneticist, whatever it might be, for ongoing diagnosis and treatment of this condition. Next slide. So what happens if there's a complaint? So one thing I think it's really important, and I know the staff members at the Board of Physicians had to kind of constantly remind us about, is that the Board of Physicians works on a complaint basis. So if there is a complaint to the Board of Physicians, the licensee will be given an opportunity for a hearing before the board and disciplinary panel. If convicted or pled guilty, the license can be suspended or revoked. A fine can be imposed in addition to the suspension or revocation of that license. And then the individuals who have their license revoked, that information is made public by the board. It's part of public record. And if it's truly revoked, you'd be unable to practice genetic counseling or refer to yourself as a genetic counselor or anything similar. And if you don't follow along with that and you do continue to call yourself a genetic counselor and practice genetic counseling, then you're subject to a $1,000 fine or imprisonment up to 1 year is the maximum. And all of this is outlined in pretty standard across all of the allied health and physician occupations. But we can always add more detail if people are interested. I run on next slide. So again, the licensed genetic counselor is anyone who has a full license. A supervised genetic counselor is someone who's between graduation and passing their board, so can't get a full license, but are working under a supervised genetic counseling license. A qualified supervisor is either a GC with 3 years of experience or a physician with 5 years of experience, would be defined as the qualified supervisor. Renewal is when you just 2 years is up and you're going to renew your license. Versus reinstatement. Reinstatement is if for some reason your license was suspended, then at that point you would get reinstatement. The other thing would be if you forgot after that first 2 years to renew your license, then at that point it would be considered a reinstatement. If it were over that 2-year mark, it would still require the same things, but there is a fee for the reinstatement as opposed to a renewal. Next slide. We have these links and resources, and we will, this again will all be posted and available to you, but there's lots of information online. We'll go back to these. These are about the criminal history records check. So again, we actually just found out today that the applications will officially be available for you to complete online on October 23rd. This all needs to be done by January 1st, 2024. Only a licensed genetic counselor can refer to themselves as a licensed genetic or as a genetic counselor in the state of Maryland as of January 1st. We can order testing as long as you have a license. There's no impact yet on billing. So licensure and billing are completely separate. Licensure is a necessary step in the process, but it's not directly linked to billing in any way. And new graduates can work and function under this supervised genetic counselor license. And of course, we are all subject to the rules and regulations of the state in which we live and work. So I think that with that, and believe it or not, we did it, guys. I'm so proud of us. We are down to just 1 minute over. And so there are 2 emails that you can reach, either MDCGC at info@mdcgc.org, or if you have questions that are more appropriate for the board staff, then their email is here, mbpmail@rcn.com. All right, so I think we'll turn it over to Leila.
Yeah, thank you so much, Carolyn and Margot. That was really helpful. So I have the job of fielding questions, and I'm going to do that by monitoring both the chat and also looking to see if anybody's raised their hands using the little emoji. I'll try and alternate back and forth. If we don't get to questions today, just please know that we are going to note down all the questions that come in. And Zoe Bogus and I are going to be doing an update to this at the MDCGC meeting in November. So if we don't address any questions today, you can either email us or we will make sure to address the questions in that presentation. So with that said, I'm going to start off with a question that was posted in the chat concerning this worry that other states may not want to fill out the verification forms, or they will charge a fee to fill out the verification forms. And a related question is whether Maryland will accept a primary source document instead of having other states fill out this form, because it seems like that's been a problem in other situations in the past. And I'm not sure who to direct this one to, but perhaps somebody on the Maryland board can help us with this.
Just a quick question. What does that second question mean, primary source document?
That came from Ashley. Ashley, do you want to unmute and clarify what you were talking about there?
Sure. Yeah. So a lot of states, if you do have like a genetic counseling licensure, they have almost like a license lookup that you can do. It is a public search. And then once you find yourself on that search, it'll give you the option to download a PDF, which on that PDF will state if it's a primary source document or not. So that's kind of an official letter from the board, real time, and it shows whether you're in good standing. It shows your license number, expiration date. And that's what we've had a lot of other states accept that from other boards.
Felicia?
Yes. So for the state of Maryland, primary source verification means that the verification is coming directly to the Maryland State Board of Physicians from the verifying entity. So we are not able to accept that document from the genetic counselor, his or herself. However, we are able to go on to the board's website to verify the license ourselves. In the event that we're unable to do so, the responsibility will ultimately be on the genetic counselor to have that state board forward verification of that license directly to the Board of Physicians.
And Felicia, actually, I'm just going to ask you a brief follow-up question because one of the questions in the chat specifically mentioned that that they had struggled with getting verifications from Virginia and Vermont. And I was just wondering, in your experience with other allied health professions, if you could just kind of talk about how that process works on receiving the verifications, just think it might kind of alleviate some of the concerns that folks have.
Yeah. So again, I can't speak specifically again to genetic counselors. However, I know Virginia is a board whose website we are able to access and download the verification ourselves. I know one of the questions was, what if the state refuses to complete our form? Completion of our form is not mandatory. We will accept the verification from the state board, their official verification, whatever that looks like. If we are unable to verify it on their website, as I stated earlier, Matt, it will be up to the genetic counselors to contact the state board. I don't know how to remedy the difficulty that they may encounter with contacting the individual boards.
And then just one thing to add, because somebody did say that some of these states do charge a fee for license verification. Anything that would be charged by other states, unfortunately, is out of our control. So we would not be able to. We wouldn't have any influence over that. Unfortunately, we do need those verifications as part of the licensure process. So if a state does charge a fee for that, it's not something that we're able to really assist with.
And just to piggyback on what Matt just said, for future references, in the event once you're licensed in the state of Maryland, our process is the same. We do have a website where other states are able to access and download verifications of licensure from our website, which are considered primary source verifications as well. However, if another state requires that Maryland forward an official verification of your license to that state, we too charge a fee for verifications.
Okay, thank you. So another question is, can we submit our own fingerprint cards if they are the standard FBI FD258 cards, or do we have to have them printed on the ones Maryland mails to us?
I'm going to say that whatever the CGIS wants you to do, you should do it.
Okay.
Because if you don't, it will get held up. It could get lost. I mean, send it back to you. Whatever CJIS says, do whatever they give you.
Yeah.
That's what you need to do.
That sounds like good advice.
And we do not, we do, and if you have, let me just back up a little bit. If you had a criminal history records check for your job, you can't use that for licensure.
Okay.
Yeah, it's unfortunately, CJIS has extremely strict laws on how they can and can't share the documents, share those background checks, who they can share with, etc. They have a lot of requirements, and it means that you will need that specific verification number that we provide. The two numbers, I'm blanking on the name. It's but we have those two numbers are provided on the application and on our website. That will solely authorize them to send it directly to our board. I will say that when the process is done in Maryland and it's done at like a live scan facility where you get the electronic fingerprints, it is generally pretty smooth. We very rarely have issues. Where we tend to see delays and where we tend to see issues are when, you know, it's something coming from out of state and they have to mail in those fingerprints, or as Ellen just brought up, when folks try to reuse criminal history record checks, they're not authorized to give us the criminal history record check that was done for another entity. So that won't ever actually get to us.
Okay. So regarding the issue we were just talking about with trying to obtain verification from other states, we have a follow-up question asking whether we will get feedback on whether there's an issue with the board being able to verify licensure for another state. In other words, if that information is not forthcoming from the other state, will the board let a genetic counselor know so that that genetic counselor can follow up, or will it be up to them to just figure that out?
No, ma'am, we would never leave you hanging. We will provide notifications of deficiencies. So in the event that we are unable to verify that license, we will notify the genetic counselor that the verification of licensure is needed from that specific state.
Okay.
Excuse me, Leila, can I clarify something about the criminal history records check?
Of course.
The online applications, all of the online applications now have a screening question, and the screening question asks whether or not you have received your criminal history records check. And if you answer yes, it's going to ask you for a receipt. And if you answer no, it's going to tell you that you can't move forward. And the reason why we do that is because the criminal history records, if you request a criminal history records check after you apply for a license, it'll just delay the process. So we want to get all these things up front. And this is not just for genetic counselors. This is for just about all of the online applications that we have.
Okay. Thank you. So this question also pertains to the discussion we were having about the sort of interstate verification process. Someone's asking how much Maryland charges other states to provide that verification in reverse.
The fee for our verifications is $25.
Okay, thank you. Do you know if that's comparable to what other states charge?
I don't.
Okay. All right.
Positions are more, just in case you want to know that.
Yeah. Well, that makes sense. Yeah. Okay. There are no more. Devin is asking if you can redisplay the link to the fingerprinting locations. I actually took a screenshot of that because I felt similarly like it would be useful to reference afterwards. Carolyn, I'm wondering if you can put that up again just so people can write down the information that was displayed there.
And I can also, I think I can copy and paste it into the chat. Margot, I guess slides, but I'll try to just drop it in the chat right now.
And I think Kathy had a question too in the chat.
Oh, that's right. I'm sorry, Kathy. So Kathy Lawson is asking, because she has ABGC certification by default, having been grandmothered in, having been certified by the ABMG in the days of yonder. She says she's in good standing and all of that, but keeping track of CEUs is not necessary for people in her situation. And so she's asking, she thinks she's going to need to provide the 3 letters of recommendation in lieu of the ABGC certification evidence. She's just wondering if that's correct. Kathy, feel free to speak up if I've misstated that.
I saw
What I mean, and I think I know that I'm supposed to keep track of my CEUs moving forward for reapplication. But my question is, because I have an ABGC certification and I'm in good standing currently, without literally having a single CEU logged on the ABGC site currently, do I need to do the letters of recommendation or do I need to do the ABGC certification? Which way do I do for my initial application?
ABGC says that you're certified.
Good standing, yes, and I'm in good standing.
Then you're done.
Okay, great, thank you.
Matt, correct me if I'm wrong, but
Yeah,
would
Stacy,
just-
do you want to?
if
Yeah, so
ABGC
that's it. You do
weren't going to say that you were in good standing, then you would need letters. Go ahead, Stacy. Sorry.
Okay,
yes, you don't need the letters. As far as renewal, the options are either you have your certification, which it sounds like you have, or you do 50 CEUs. So if you're not required to do CEUs for renewal for your ABGC, I guess you're one of the few lucky ones that squeak by without CEUs. I don't know that that was made aware to us at the committee meeting when we were doing the rulemaking, but that's how the regulations are written at the moment. So.
okay, I mean, literally, it could be me only. Like, I have no idea who else in the state of Maryland this applies to. But that my institution makes me collect CEUs. So just so you know, there are CEUs that I can log. I just have not been doing that.
That makes me feel good.
And just to kind of clarify about the CEU process in general, for those who need to collect it, you are never going to be providing those CEUs to the board unless requested. We require that as part of your renewal application, you will have to attest that you have met the CEU requirements, either by maintaining your certification or by having at least 50 CEUs. You will only be asked to, we have an internal audit system that will periodically audit these applications. So you may be asked by the board at some point if your license happens to get pulled for an audit, but you don't need to submit those with your application. You just need to keep those on file. And we ask that you keep those on file for 6 years so that, if it does come up and we do need to audit it, audit your CEUs, we have the ability to do so.
Yes,
Great.
so just to piggyback on what Matt just said, the way the audit works is that while you're in the renewal, once you complete your renewal and attest that you have your CEs and submit your renewal, you could automatically get a pop-up window that says, hey, you're being audited. So please forward verification of the CEs to the Maryland Board of Physicians. So generally, the audit, you're notified within moments, sometimes after submitting your renewal application. So you'll know almost right away if you are one of the renewal people who's being audited.
So I have another question from Marie, who's asking, if we don't currently see patients in our role, is it necessary to be licensed by January? She's basically asking if her role changes in the future such that she eventually does see patients, can she get licensed then and not worry about it now? Stacy, I think you're on mute.
You want me to?
Yeah. Oh, yeah. Yeah.
Sure. Yeah.
Go ahead.
So I'm happy to answer that one. So unfortunately, it's not just whether you see patients or not, it's whether what your role includes is within the practice of genetic counseling as it's defined in statute. I can't give legal advice to individuals outside of the board. So you would have to, consult with your HR, your employer's attorney, private counsel, someone outside of the board to determine whether your scope of practice is involved with the practice of genetic counseling. We can't look at your job and tell you, yes, you need a license, or no, you don't need a license. That's something that, you, your employer, your own private counsel, again, as I said, will have to make that determination for you. I hope that answers your.
I would just add on to that. There are requirements regarding misrepresentation to the public. So it is not just practicing, but also under Maryland law, unless you are authorized to practice genetic counseling under the law, which means generally having a license. I know that there were some small exceptions that came up, such as consultations and things like that. But unless you're authorized to practice under the law, you cannot represent to the public that you practice genetic counseling, and that includes the use of the term genetic counselor, licensed genetic counselor, gene counselor, genetic consultant, genetic associate, or any words, letters, or symbols with the intent to imply that the person practices genetic counseling or is a certified genetic counselor or licensed genetic counselor. And again, that is in the law. It's 14.5G24.
I also want to point
Thank
out
you,
that that the fee is dependent, that future fees depend on how many people apply for licensure, right? So the less people that apply, it means that after those 2 cycles, that means that you're not counted. And so the fee is potentially higher than if everybody does it. Just a thought.
Yes, I'm now recalling a story about the genetic counselors in Idaho who paid, I think, $1,000 each for their first ever licenses because there were so few of them. So I doubt we'll be in that situation, but that's something to think about. We also just have a quick question from Wendy asking, she says she knows the webinar is being recorded, but would want to know if she can also have, or if the audience can also have access to the slides.
Yep, we'll put them on MDCGC's website.
Put them on the website.
If you don't have access to that, just email the info@MDCGC. Right, Rachel?
Ashley is asking, for those who reside or are located out of state, do we request the fingerprint cards from the board or the CGIS fingerprinting services directly?
CGIS. Always contact CGIS. The board has no ability to access or request background checks. You have to request that directly from CGIS.
Request it from CGIS directly. And my impression is they do this all the time. So it's kind of like a machine. They just, because I remember having to do this before. So they should get back to you pretty quickly. And then she thanks the speakers for their efforts. This has been very helpful.
I did want to just correct one minor point when talking about the applicants that are taking that alternative pathway. So they're not certified and they're going through the alternative pathway. I believe the slides stated that they needed to have practiced for 10 years in Maryland. The law actually only requires that they've practiced for 10 years. It does not specify Maryland. So as long as you've practiced for 10 years with at least 5 of those years immediately preceding application, that should qualify.
Thank you for that clarification. I think many people will be happy to hear that.
I think
go ahead, sorry.
Sorry, just to re-highlight, I know we said it, but it's just really important that people understand that if you ever want to get a license in Maryland and you are not ABGC certified, you have this first year to get that, and then going forward, you can just renew. But it's just, I want to make sure that that's clear, that it is time limited in the statute, that there's exemption only lasts for this 1 year.
All right, so Sumati is asking if licenses in other states have expired, do those still need to be verified? They do.
Yes.
Okay, I didn't know that. So that's helpful. And Joe asks if Canadian GCs who work in telehealth from Canada, can they apply if they are ABGC certified?
There are no residency requirements with the license. So, it's as long as you meet the educational and certification requirements, you are eligible for licensure.
Yeah. So we've also got this sort of sub thread going on in the chat about whether GCs employed by the federal government don't need state licensure. Yes, that's true. The statute does provide an exception to government employees. However, if the clinical director of the hospital on the NIH campus wants the GCs in that hospital to be licensed, I think they need to be licensed, right? So if government employees who work in a hospital that is government owned are told by their clinical director that they need to be licensed, I think that trumps their exemption from the need to be licensed in the statute. At least that's my understanding. So if you work for FDA, maybe you don't need to be licensed, but if you see patients in the NIH Clinical Center, it is very likely that you will need to be licensed, and we're sort of still hashing that out. But probably we'll have some kind of town hall Q&A for NIH and Walter Reed hospital employees separate from this.
The board's licensure requirements have no bearing on what employers do or do not require.
That's right. Yeah. And this is, I think, a classic example of that. So if you're in a role like mine, where I work for the federal government and I don't see patients, I thought I would potentially be exempted, but it sounds like if I want to call myself a genetic counselor, I might want to get licensed anyway. So that's kind of still a developing story, but all signs suggest that if you work in a government hospital, you will need to do this as long as that hospital is in Maryland. And then Beth wanted to know, when are the slides going to be up on the website? So soon, I think, right?
I'll do that quickly. I can try to do that today or, at the latest next week. So yeah, we'll try to get them up there today, and it'll be on the page, licensure information. So you can navigate there from our homepage.
Yeah. And I think, the point, sorry, going back to the point I just made about the NIH genetic counselors, I think this sort of raises a general principle, which is that it's a good idea to investigate how your local compliance department, your clinical director, whoever makes these decisions at an institutional level in the place where you're employed, you need to be able to provide information about the statute to them so that they don't misinterpret it, and also have some understanding of how the institution is going to support you to get this done, and how they interpret the rules, because certainly, there may be some use cases where you are exempted by law, but the institution may still want you to have it for reason X, Y, Z. And so that is why I think Margot emphasized at the start, make sure that you're also talking to your institution about how this is going to roll out, because there will be variations. All right, so I think we've addressed all the questions in the chat. Does anybody have any final questions or thoughts to share? Feel free to just raise your hand and speak. You don't have to put it in the chat necessarily.
We're also happy to look at people. Turn your camera on.
I just want to thank the Board of Physicians staff for coming to this and taking the time out of their Friday to attend and answer our questions. They have been absolutely lovely to work with. And so just a personal request is, please make sure that if you have questions in the future, that you, one, read the law, two, look at the FAQ or listen to this webinar again. If it isn't answered, then please email them. So please use your resources appropriately before reaching out to them to answer questions that they might have already answered in this webinar. So thank you.
Yeah, thank you everybody for attending. And as I mentioned, we will be giving an updated version of this talk at the MDC-GC meeting. And so any nuances that haven't been addressed here, we will try to address them there.
And we'll send out another link to collect questions for that in the upcoming weeks. So if you think of something between now and then, feel free to shoot that over. Thanks for everyone's time.
Yeah.
Our board friends.
Thank you, everyone. We'll get this on the website as soon as possible. Take care.
Yeah.